Hello and welcome to this podcast brought to you by the Isle of Man Anti-Cancer Association. My name is Malcolm and I'm chairman of the Isle of Man Anti-Cancer Association and a former surgeon.
And my name's Sandy and I'm the executive officer of the Isle of Man Anti-Cancer Association and a cancer survivor. In this podcast we want to talk about esophageal cancer. Some 12 or so island residents will be diagnosed with this condition each year, just over 9,000 annually in the whole of the UK. Esophageal is twice as common in men as it is in women. It's rare under the age of 35, but then the incidence rises to peak at the age of 70 in men and 80 in women, with 40% of cases occurring in people over the age of 70. Although esophageal cancer makes up only 3% of all cancers, it is the 6th commonest cause of cancer death. This is due to around 3/4 of the cases presenting during the later stages of the disease. So, it's important to know something about esophageal cancer.
The esophagus, also known as the gullet or food pipe, is part of your digestive system. It connects the lower part of your throat behind the voice box to your stomach. The esophagus in an adult is about 10 inches long and is normally closed throughout its whole length. When food is swallowed, the upper part of the gullet initially relaxes to allow food to enter, and then contracts and slowly squeezes the food down into your stomach, and it can take several seconds for the food to reach your stomach.
Now, there are two types of cancer that arise in the esophagus. Most of the gullet is lined by flat cells, called squamous cells, that can give rise to squamous carcinoma, but the lower end is covered by taller glandular cells, which can develop into adenocarcinoma. The incidence of adenocarcinoma of the esophagus is increasing, probably due to the number of lifestyle factors that we will talk about later. It's important to know which type of cancer someone might have, as squamous carcinoma will respond well to radiotherapy, whereas adenocarcinoma tends to respond very poorly.
So what are the symptoms of esophageal cancer? The commonest symptom is difficulty in swallowing food, known as dysphagia. This usually starts with things like bread or meat and a sensation of food sticking in your throat or chest. It may be eased by swallowing liquids, particularly something fizzy, or you may even regurgitate the food. Other symptoms include persistent indigestion or heartburn, weight loss, pain in your throat or behind your breastbone, or a cough that will not go away. These symptoms do not mean that you have cancer, as it may be caused by other benign conditions, but it's important to remember that patients with early disease have a tenfold chance of being alive 3 years after treatment than those with late disease. So please go and talk to your doctor if you have any of these symptoms, rather than wait to see if things will settle.
Now, there are a number of lifestyle choices which might increase the risk of anyone developing esophageal cancer. Being overweight or obese, the heavier you are, the greater the risk. Smoking or using tobacco. Drinking alcohol. Anything over 14 units a week significantly increases your risk, especially if you also smoke. A poor diet, particularly one containing a lot of processed meats. So, there are some positive lifestyle choices which can obviously reduce your risk. So, watching your weight and having plenty of exercise. Not smoking or consider giving up smoking if you already do so. Drinking alcohol in moderation, no more than 14 units a week. And eat plenty of fibre from fresh fruit and vegetables every day.
There are also some specific conditions associated with an increased risk of developing esophageal cancer. A condition known as tylosis, a rare familial condition with thickening of the skin in the palms of the hands and the soles of the feet, is associated with a higher lifetime risk of developing squamous esophageal cancer. Achalasia, a disorder of the contraction of the muscles of the gullet, is known to very slightly increase your risk. And there is also a condition called Barrett's esophagus, due to long-term acid regurgitation, where 1 to 5% of individuals will develop adenocarcinoma of the esophagus.
So let's just quickly recap the symptoms again. A sensation of food sticking in your gullet or regurgitation of food that has occurred on more than one occasion. Indigestion or heartburn, weight loss, pain in your throat or behind your breastbone, or a cough. Any of these symptoms that last for more than 3 weeks.
If you have any of these symptoms, it does not mean that you have esophageal cancer, but it's always best to get any possible symptoms checked out. Go and see your GP. The chances are that there is nothing serious going on, but if there is, getting an early diagnosis is going to give you a better outcome.
If you'd like more information about esophageal cancer, the Cancer Research UK website is a good place to look for information at cancerresearchuk.org. Or you can visit the Macmillan Cancer Information and Support Centre up at Nobles Hospital. You can telephone them on 650735 or have a look at the website cancer.org.im. Thank you for listening.